Hi, this is Nursing, Work, Culture, and Identity, Chapter 5 of Malka by Angela Lauer. My questions. Nurses at this time were working hard to change what society thinks a nurse's work entails. What changes were made to make the public aware that nursing was a profession and not whatever doctors and janitors won't do? Do you believe that feminists helped nurses develop more autonomy and confidence in their profession? Second wave feminism involvement. Before second wave feminism, nurses perceived their job as following physicians' orders. Nurses could not envision a role with expanded power, authority, and responsibility. Due to second wave feminism, nurses saw new visions, new role models, and a new concept of womanhood and femininity that promoted assertiveness and no longer supported or encouraged their subservience. Nurses' work had changed. Between 1965 and 1985, nurses' work changed significantly. They were now politically involved and gained political skills. They joined unions. They specialized in their roles. Example is became NPs, or nurse practitioners. They made crucial decisions on their own, unthinkable a decade earlier. Unfortunately, nurses' salaries were still low. Compared with a nurse's closest colleague, the physician, nurses' pay was still low. In 1945, nurses were paid one-third of a physician's salary. By 1981, it was even worse, with nurses only earning one-fifth of a physician's salary. Defining nurses' work. In the beginning of the 20th century, a nurse was indistinguishable from a domestic servant or mother. The nurse cooked, cleaned, made beds, changed bandages, and bathed patients. In Malka, one of the head nurses even stated, "Nurses do whatever janitors and doctors don't do." Later on, physicians passed down tasks to nurses, such as taking temperatures by thermometers, using stethoscopes, blood pressure cuffs, gave oral and injectable meds, and did IVs. Due to nurses' new roles, some of the tasks had to be done earlier years had to be delegated to auxiliary staff, such as the tasks of giving patient baths, or as the text states, bed and body work, which was once the core of nursing. As of today, we have certified nursing assistants helping us with such things like giving baths and massages, walking patients, things like that we used to do more of back then, and now we had to actually delegate those because we were doing more such things as IVs, injections, and so forth. Advancement in technology. Advancing technology also changed the role of the nurse. New machinery was added and introduced in the 1960s. Nurses now were able to use such things as electronic beds, kidney dialyzers, computerized record-keeping systems, and electronic monitoring devices. With the new technological advancements, nurses' roles were repositioned in their relationship with patients, physicians, and other nurses. For example, with an electronic monitoring device, a nurse could leave the patient's bedside and do something else while listening for the warning beep. This did make it possible for the nurses to leave the bedside to do other things, but also took away from the bedside care that nurses were used to doing, in effect, spending less time with the patient. There still was the doctor-nurse game. It was based on physician dominance. If a nurse had an opinion, you should keep it to yourself. A nurse is chiefly a sponge and a buffer, a silent partner to medical decisions. When the game worked well, patients benefited from the doctor-nurse cooperation. When the game did not work well, patients suffered due to doctor-nurse discord. This is a big problem for feminists because that's why they viewed nurses as subordinate to physicians, because it still is based on physician dominance, and they oppose this strongly. Growing autonomy in nursing. Through the years, nurses continued to gain increasing autonomy, which of course was opposed by physicians. With the nurses' growing autonomy, the nurse supported patients in their efforts to gain a sense of control and to participate actively in their care and recovery. In effect, patients started questioning physicians' authority and started to ask for information and second opinions. Physicians felt like they were starting to lose their ground. Growing autonomy in nursing continued. This is a major change from post-World War II decades when a physician held most authority and pretty much all authority in a rigid and stratified hospital hierarchy. For example, a physician was not okay with nurses' growing autonomy and their loss of control when in 1981 a physician refused to speak to any nurse in the hospital who did not wear a cap. In 1980, the ANA, American Nurses Association, issues Nursing, a social policy statement. This statement redefines nursing and stated, nursing is the diagnosis and treatment of human responses to actual or potential health problems. This statement provided the following: offered guidelines for nursing practice and education, endorsed a new tone for nurse-physician relationships, collaborated with other health professionals without specifically naming physicians, and the emphasis was on equality and cooperation, which the feminists supported. Specialization in nursing. In the 1960s, an increasing number of nurses turned to specializing in their professions to express their desire for greater autonomy. This opened the door for nurses to specialize in areas once closed to nurses. Two critical events promoted specialization in nursing. One was the passing of the Nurse Training Act under the Title VIII of the Public Health Care Service Act. This act funded master's degree programs. And number two was inauguration of the first NP or nurse practitioner program. Prior to the 1960s, few nurses earned graduate degrees and almost none specialized. Increased nursing education programs emerged from 1965 to 1985. In 1965, 53 master's programs enrolled 2,836 students. In 1985, 167 master's programs enrolled 19,315 students. In 1965 also, 4 nursing doctoral programs existed and enrolled 157 students. By 1985, 33 doctoral programs existed and enrolled 1,788 students. Specialization and certification of nurses. Specialization and certification of nurses accelerated in the 1990s. Some nurses that specialized were given the title Advanced Practice Nurse, or APN, and Clinical Nurse Specialist, CNS. To become certified in your area of expertise, you needed to take an exam. The exam is voluntary. It's not required. For example, to be an RN, you need to take the boards, as everybody knows. To be certified, you already have your RN, but you voluntarily take another exam to be certified in your area of expertise. Raising nurses' consciousness. Between 1965 and 1985, nursing began to change. More men started getting into nursing, and even though nurses were still prominently white females, the profession was changing. Feminists versus nurses. Although feminists seemed to support nurses in their work, they still identified nurses' work as subordinate to men, so sometimes feminists and nurses did not agree. Some feminists rejected nurses on this basis. Nurses were working hard on becoming liberated in their field. Feminists wanted equal rights between men and women and were hoping for a change. Conclusion of Malka, Chapter 5. There were many productive changes in the nursing profession from the 1970s through the 1990s. Nurses specialized in their professions. More technological advances were made. Nurses' work was defined. Doctors learned to respect the work of nurses. Great strides were made in nursing, but many more were yet to come.